Gentlemen, let's start with a simple truth. The prostate may be small, but its impact on your overall health is enormous. For most men, especially after the age of 50, the prostate begins to change in size, shape, and function. These changes are not always a problem, but when they are ignored, they can grow into something serious. That's why recognizing early warning signs is absolutely crucial. Think of this as your body's check engine light. The earlier you pay attention, the more control you keep over your health, your energy, and your confidence. So, what exactly is the prostate? In plain language, it's a walnut-sized gland that sits right below the bladder. Its main role is to help produce semen, but it also plays a key role in urinary control. Because of where it sits, any swelling, irritation, or growth can press against the bladder or the urethra, the tube that carries urine out of the body. This is why many of the first warning signs of prostate trouble show up in the bathroom. One of the earliest signs is frequent urination, especially at night. If you find yourself getting up 2, 3, or even 4 times a night just to urinate, that's not simply old age. It could be your prostate telling you it's under stress. Many men shrug this off as normal, but healthy aging doesn't have to mean running to the toilet all night. The bladder and prostate are supposed to work in harmony, and when they don't, it's worth paying attention. A second early warning sign is weak urine flow. Instead of a strong, steady stream, you might notice a slow, interrupted flow or feel like you're straining to get the urine out. This happens because an enlarged or irritated prostate can squeeze the urethra, making it harder for urine to pass. It's like stepping on a garden hose. The pressure builds, but the flow weakens. Another symptom men often overlook is the feeling of incomplete emptying. You finish urinating, but moments later you feel like your bladder is still full. That never quite done feeling can be a frustrating daily reminder that something isn't right. Left unchecked, this can lead to more serious bladder problems or even infections. We also need to talk about pain or burning during urination. Many men assume this is just a temporary irritation or dehydration, but it can actually be an early sign of inflammation in the prostate, called prostatitis. While not always dangerous, prostatitis is a sign your prostate is irritated and it needs to be taken seriously. And here's a warning that surprises many men. Blood in the urine or semen, even tiny traces that appear once and then vanish, are never something to ignore. This doesn't automatically mean cancer, but it does mean something is off and deserves professional evaluation. Now, I want to pause here and make an important point. Having one of these symptoms once in a while does not always mean you have a major prostate problem. But when these signs keep repeating, when they start to interfere with your sleep, your confidence, or your daily life, that's your signal to get checked. Remember, the earlier prostate trouble is identified, the easier it is to manage. Why does this matter so much for men over 50 or 60? Because the risks go up with age. Benign prostatic hyperplasia, or BPH, which is simply an enlarged prostate, is extremely common. Prostatitis, or inflammation, can strike at any age, but tends to be more common as men get older. And yes, prostate cancer is a risk, especially after 60. The key point is this: none of these conditions appear overnight. They often start with subtle, nagging symptoms that men push aside as just part of getting older. Here's the bottom line. Your body whispers before it shouts. If you ignore those whispers, the nightly trips to the bathroom, the weak stream, the birding, the lingering pressure, they will eventually grow louder, and by then, it can be harder to treat. So, in this first section, we've covered why prostate health matters and the first warning signs that deserve your attention. In the next section, we'll dive deeper into the more subtle daily changes that men often miss, the quiet clues that your prostate might be in trouble long before obvious symptoms appear. Now that we've talked about the obvious signs, like frequent urination, weak stream, or pain, let's shift to the more subtle daily changes that many men overlook. These are the signals that creep in slowly, the ones you might brush off as just being tired or part of aging. But often, they're early red flags from your prostate that should not be ignored. One subtle sign is lower back, hip, or pelvic discomfort. Many men don't connect this kind of pain to the prostate at all. But because the prostate sits so close to the pelvic muscles and nerves, inflammation or growth in the gland can cause an ache that radiates into these areas. If you find that your lower back feels stiff or sore, especially in the evenings or after sitting, it's worth noting, especially if it pairs with other urinary symptoms. Another overlooked warning sign is erection changes. Now, let's be clear. Occasional performance issues can happen to any man, especially with age, stress, or fatigue. But when changes in sexual function show up consistently, it can be linked to circulation and prostate health. The nerves and blood vessels involved in erection run right past the prostate. If the gland is inflamed or enlarged, it can reduce the strength and quality of erections. Many men feel embarrassed to talk about this, but it's one of the body's most important signals. Here's another clue: feeling unusually tired or drained after normal daily activities. Of course, energy can dip as we age, but persistent fatigue, especially when it comes with other signs like frequent urination or pelvic pressure, may suggest your prostate is working harder than it should. The bladder, for example, may never fully empty, leaving your body in a constant state of strain. That hidden energy drain often shows up as, "I just don't feel like myself anymore." Let's talk about bowel habits. Because the prostate sits right in front of the rectum, swelling or enlargement can sometimes create pressure that affects bowel movements. You may notice constipation that doesn't improve, or the feeling that your bowels don't fully empty. Again, many men won't link this to prostate health, but it's a clue that shouldn't be ignored. Another subtle warning is difficulty starting urination. You go to the bathroom, but it takes a few seconds before anything happens. Some men joke about this hesitation as a normal part of getting older, but it's not normal. It's a sign of pressure or obstruction around the urethra caused by the prostate. If that hesitation keeps happening, it's worth mentioning to your doctor. Now, here's one that really sneaks up: changes in mood and mental sharpness. Poor sleep from waking up multiple times to urinate can drain your energy and affect focus. Men often think they're becoming forgetful or irritable because of age, but in reality, it's the repeated disruption of rest caused by prostate issues. Sleep is when testosterone levels recover, when your body heals. Without it, you feel groggy, moody, and less like yourself. That mental fog isn't just aging. It could be your prostate interfering with quality rest. Finally, let's mention urinary urgency, the sudden, hard-to-control feeling that you must go right away. It might happen in the car, in a meeting, or while out with friends. It's embarrassing, frustrating, and it chips away at confidence. Many men start limiting activities or avoiding long trips because of it. That urgency is often one of the earliest and most noticeable effects of an enlarged prostate. So, why do these subtle changes matter so much? Because they add up. On their own, each one might not seem alarming, but when you put them together, the fatigue, the hesitation, the pelvic discomfort, the erection changes, the constant urgency, they paint a very clear picture. That picture is your prostate waving a flag saying, "Something is wrong and I need attention." The good news is this: catching these signs early gives you options. Prostate issues don't always mean cancer. Many times it's benign enlargement or inflammation, both of which can be managed with lifestyle changes, medications, or simple adjustments. But if you wait until symptoms are severe, treatments become harder and recovery takes longer. Here's the key takeaway for this section. Don't minimize the small changes. Don't dismiss them as just age. Instead, keep track, pay attention, and talk openly about them.
because the sooner you address them, the more control you'll have over your energy, confidence, and daily life. In the next section, we'll move into the more serious warning signs, the ones that should never, under any circumstances, be ignored. These are the signs that demand immediate attention and medical evaluation. Up to this point, we've gone over the early and subtle signs. Now let's move to the serious warning signals, the ones that no man should ever ignore. These symptoms go beyond being an inconvenience or an annoyance. They're the red lights on the dashboard of your health, the signs that require immediate evaluation from a doctor or urologist. The first major red flag is blood in the urine or semen. Even a small amount can be a sign of infection, inflammation, or something more serious like prostate cancer. Many men try to rationalize it, thinking maybe it's from exercise, from strain, or from something temporary. But here's the truth. Blood in the urine or semen is not normal at any age. If you see it once, and especially if you see it more than once, you should book a medical appointment right away. Another critical warning is painful urination or ejaculation. A burning sensation, sharp pain, or ongoing discomfort in these moments often points to infection, prostatitis, or blockage. These symptoms can greatly reduce quality of life and, if untreated, may lead to long-term complications. Don't suffer in silence. Let's talk about difficulty fully emptying the bladder. Earlier, we mentioned hesitation or urgency, but this is more serious. If you feel like your bladder is never truly empty, or if you have to push or strain to pass urine, that's a clear sign of obstruction. The danger here is that leftover urine in the bladder increases the risk of infection, bladder stones, and even kidney damage. It's not something to shrug off. The next red flag is pain in the bones, particularly in the hips, spine, or ribs. Advanced prostate cancer can spread to the bones, and persistent bone pain can sometimes be the first sign. While bone aches can come from arthritis or aging, pain that doesn't go away, especially when it worsens at night, is something that must be checked urgently. Another symptom that should never be ignored is unexplained weight loss and fatigue. When your body is losing weight without you trying, and you feel weak, drained, or tired all the time, it can point to more advanced disease. Combined with other urinary symptoms, this is a reason to see a doctor immediately. Now here's one that surprises many men: loss of bladder control or sudden incontinence. If you notice leaking when coughing, sneezing, or lifting, or if you find it impossible to hold urine, that's not just old age. It can be the result of serious prostate changes or damage to the nerves and muscles around the bladder. Another big red flag is erectile dysfunction that develops quickly and doesn't improve. Occasional performance issues are normal, but if you suddenly notice consistent problems and they come with urinary changes or pelvic discomfort, it may be linked to prostate disease or circulation problems tied to prostate health. Let's not forget persistent pain or pressure in the pelvis, or perineum, the area between the scrotum and anus. This type of pain often signals ongoing inflammation or infection in the prostate. It's uncomfortable, distracting, and can interfere with everything from sitting to walking. Chronic pelvic pain should always be taken seriously. So, what's the key point here? All of these serious symptoms, blood in urine, bone pain, bladder obstruction, severe pelvic pain, weight loss, are not just inconveniences. They're alarms. They're your body's way of saying something is wrong and it needs immediate attention. Now, here's where many men make a mistake. They delay. They hope it will go away on its own. They keep quiet out of embarrassment. But prostate issues don't improve by ignoring them. In fact, waiting usually means the condition becomes more complex and harder to treat. The truth is, early diagnosis saves lives. Modern medicine has advanced treatments that can manage, reduce, or even reverse many prostate problems, but only if you take action early. Whether it's simple medication, non-invasive therapies, or lifestyle changes, options exist. But the first step is to recognize the serious warning signs and seek help. Remember this, it's not weakness to ask for medical help. It's strength, it's courage, and it's one of the smartest investments you can make in your health, your independence, and your ability to keep living life on your terms.
So, to bring it all together, your prostate health is not something to ignore or put off until tomorrow. Those little signals, frequent urination, trouble starting, waking up multiple times at night, pelvic discomfort, or changes in sexual function are your body's way of whispering, "Pay attention." The earlier you listen, the easier it is to protect your health, your independence, and your peace of mind. If you recognize even one of these early warning signs, don't wait. A simple conversation with your urologist could save you months, even years, of discomfort and prevent something more serious down the road. Remember, taking action now is not just about living longer, it's about living stronger, with more energy and confidence every single day. Before you go, if this video helped you or gave you something to think about, please hit that like button. It really supports the channel. And don't forget to subscribe and share this with a friend or family member who might need to hear it. Sometimes sharing one video can make a life-changing difference for someone you care about. Stay informed, stay healthy, and I'll see you in the next one.